also follow non-compartmental models or the non-compartment analysis of the disposition kinetics is always taking place. So here non-compartment analysis is another approach to study the time course of the drug in the body. What happens as the time go on increasing, what happens to the drug, whether the concentration is same initially 1 hour, 2 hour or 3 hour, because one has to find the half-life of the drug, then elimination rate, then peak plasma concentration and biotransfer. So many processes are there. So to make it easy, so many calculation processes are there. So that's why the second one is, first one is the compartmental models, whereas the second one is the non-compartment models or non-compartment analysis. So it does not require the assumption of specific compartment. Here there are no called as the assumption of the compartments, just like the 1 compartment, 2 compartment like. But it considers the time course of the drug concentration in plasma as statistical distribution curve and derives pharmacokinetic parameters by simple algebraic equations, simple equations. So especially in case of kinetics, so many times it becomes very difficult because there are so many formula are there, then so many calculations, then once again the different tough process, because whenever you want to see the concentration of the drug in the plasma, you have to take the plasma, then in every hour calculate the concentration and also the tissue in which and you have to sacrifice some animals for taking the tissues, what is the tissue concentration, etc. So to avoid all these things, they are following the other methods like non-compartmental models. So here we can calculate as simple algebraic equations, but please remember one thing, that we cannot calculate the what you call as this all the parameters using any single formula. Any single formula cannot suit. It depends upon the drug. Suppose the drug do not have any distribution, like the penicillin, then 1 compartment open model, whereas it is got the elimination and biotransformation like the sulfur drugs or this amoxicillin, so many other drugs, then it's 2 compartment open model. Whereas whenever there is a tissue distribution, means the bone and teeth, etc., if it is distributed by the drug, then it's called as the 3 compartment open model. The disadvantage of this model, especially non-compartment model, is that often deals with the average and provides limited information regarding the plasma drug concentration time profile. Whereas the compartment models, they are little bit accurate when compared to the non-compartment models. Suppose if you want to calculate the time information or the concentration profile of the drug, then this is not so important. This is not so accurate because this is dealing with the averages and provides the limited information. So here non-compartmental analysis is model independent method because it does not require the assumption of specific compartment. Always it's an assumption. You see that it is not sure, we cannot make the drug. Yes, you enter the liver, kidney and first, then you can enter the skin or the bone tissue. It is not like that. Just for calculation purpose, we have made it like that, and because it is not require the assumption of specific, that's why the specific compartment model. And this model is based on the assumption that the drug metabolites follow linear kinetics. So this technique can be applied to any component models. And there are varieties of the differences. These require elaborate assumption to fit the data, and non-compartmental, they have got their own advantages and disadvantages, do not require assumption to compartment model. And the curve fitting to the experimental data using computers, it is a tedious method, whereas this is a very simple method, especially non-compartment model, no curve fitting or no computers. And the application to linear and non-linear pharmacokinetic is there, and application to only linear means a straight line. Linear means straight line. C1 time profile is regarded as the expression exponent. C1 time profile is regarded as the statistical distribution, and they are useful of most of the situation, especially in the compartment models, through assumption of the modeling are involved, whereas in the non-compartment models it is particularly useful for the application of clinical pharmacokinetics, bioavailability and bioequivalence studies. The non-compartmental pharmacokinetic methods permit a comprehensive pharmacokinetic analysis without resort to curve fitting or sophisticated computers, as already it is told. And these methods cannot be applied to all the pharmacokinetic problems, and they are useful for most of the problems and are particularly useful for the clinical application of the pharmacokinetic. Because suppose a new drug has arrived and immediately you want to give it without any pharmacokinetic analysis in the animals, then simply you can calculate the dose, etc., by this particular method. And third one is the physiological models are there. Physiological models, perfusion rate limited models are there. Perfusion versus rate limited models. It's a newer approach devised to study the time course of the drugs in the body. What happens after a certain time to the drug concentration? That's studied by the physiological model. The basis for this method is that each major organ system plus any specialized target site represents a physiological compartment. So we have already learned that one compartment, two compartment and three compartment, and here also the physiological compartment, wherein which we are going to study the actual this system. Here we have got the very specific target site and the major organ of the system which elimination and biotransformation takes place. So each separate component has its own blood flow, tissue volume, uptake process, affinity for the compound, that is the partition coefficient, and elimination process. Each separate compartment has its own blood flow, just like earlier it is told. So that's why thus the kinetic of the drug is described by a series and series of the events and flow related equations which can be solved following the incorporation of the known physiological values, example organ or the tissue or volume, and perfusion rate, and experimental estimates, example the tissue to plasma partition coefficient. So tissue to plasma concentration means whenever the concentration of this plasma is more, it is getting percolated to the tissues, and whenever the concentration of the drug is more in the tissues, it is going to be equilibrated with that of the plasma. That's known as the plasma partition coefficient. The physiological models have some advantages as they are drawn on the basis of known anatomical and physiological data, and they present a more realistic picture of the drug disposition in various organs and tissues. Here we are considering each organ as an individual unit and going to calculate the metabolism, excretion, etc. That's why it's more realistic. But once again, every model has got its own advantages and disadvantages. The physiological models also allow an assessment of the impact of altered physiology, example aging or pathology on the drug disposition. Yes, here in the 1, 2 or 3 compartments, this parameter is not included, in which the physiological models can fulfill. In the physiological models, the altered physiology, example, suppose there is a aging and there is a cancer of the kidney or the liver, then the entire process is totally changed. So in such thing, a patient is having the physiological, what you call as the altered physiological state or altered pathological state, and the drug is administered. In such cases, we require another model that's known as the physiological model. So more importantly, species difference can be predicted based on known perfusion rates. Especially this is very important in case of veterinary practice, because each animal is different from its own because of the physiological alterations are there in many varieties of the animals. And the only disadvantage of the physiological model is obtaining experimental data which is very exhaustive. because the physiological model with the many times the animal experiment need to be conducted, and it requires the approval of the animal ethics committee and say the sacrificing and hourly taking the blood out. So whereas in case of the other models, this is not a what you call exhaustive study, but this is one of the physiological model study is one of the most reliable study, because the most of the time the drug is administered to a patient who is suffering from some diseases, is it not? So that's why, whereas the drug cannot be administered to the patient who is not suffering from any disease. So here you can see that many of the examples are given. The usually the arterial blood and venous bloods are there, and usually whenever the drug is administered through the intravenous route, then there will be equilibration between the QH, then QG. Here you can see that Q indicates the blood flow to a body region, heart, the CV is the venous concentration, M indicates the concentrate for hepatic metabolism, and the elimination, KE is the first order rate kinetic of the urinary system, etc. So here all the organs get the drug to one or to the other extent. And here another thing is that the input, whenever the drug is put inside the body, then there will be altered output. So this is possibly the simplest application of multi-compartment. This is the multi-compartment model. Okay. It is the volume of the cell. Here also some of the equations are there, where input is UT and the secretion of the solution is proportional to the density of it with the cell. That's one of the important thing. Then the concentration of the solution C within the cell over time is given by this particular equation. Please remember some of the equations, especially in the kinetic studies concerned. So once again, as the number of this particular increases, the model can be very complex and the solutions usually beyond ordinary calculation. Totally, the pharmacokinetic is a calculative process, and below shows a 3-cell model with interlinks between each other. The formula for N cell means N, here you can put any number depending upon the what you call as your statistical calculation. And multi-compartment models, here this is the example for the multi-compartment model, single compartment or the 2-compartment, 3-compartment and multi-compartment, and physiological models. Then model topologies, today we are going to finish the unit 1, so I will take little more time. As the number of the compartment increase, it is challenging to both find the algebraic and numerical solutions of the model. However, there are special cases of the models which rarely exist in the nature, and when the topologies exhibit the regularities, that solution become easier to find. The model can be classified according to the interconnection of the cells and input to output characteristics. What is a closed model? No sinks or sources. Closed model means there are no sinks, bone or anything. Whereas the open model, one compartment open model, there are a lot of sinks and sources among the cells. Quaternary model, all compartments are arranged in a chain with each pole connecting only to its neighbors. This model has 2 or more cells, already it is explained. And cyclic model, this is a special case of the quaternary model with 3 or more cells in which the first and last cell are connected. Then mammillary model consisting of the central compartment with peripheral compartments connecting to it, central and peripheral. There are no interconnection among the other components. Component 3 to component 2, there are no connections, whereas in case of other models it will be there. And reducible model is a set of unconnected models. So why we are calculating the compartment model, why it is required so much exhaustively we have studied? Because the pharmacokinetic models predict drug disposition after drug administration, The statistical methods are used for the estimation of the data interpretation of pharmacokinetic parameters, and this is useful for the drug formulation and treatment regimen, because the physiological model also deals with the patient who is having altered physiological status or pathological status. That's why while formation of the drug and how much quantity should be present in a particular tablet or bolus and what should be the route of administration, all this it's very important. And drug behavior within the body might be able to fit different compartments models depending upon the route of the drug administration. See, each drug will follow its own what you call as the compartments, one compartment, two compartment, depending upon its chemical nature. Suppose if it is a drug with a highly plasma protein bound and liphophilic, then definitely it will follow the three compartment open model. Whereas the drug with high plasma protein binding, highly liphophilic in nature, and also sometimes it's more acidic, then it will follow the multi-compartment models. And any drug which is administered in the animal which is having some pathological disorder, then it is following the physiological model. So this is all the gist why we are going to study all these things. And with this